Another source of misinformation about Amendment 3 is that a lot of people are being told that they will not be able to get care for their miscarriages or ectopic pregnancies. And this is obviously a great concern to women because many women have miscarriages. I've had miscarriages. It's a very sad and common scenario for women. And when you are in that setting, you need to get care as soon as possible. So the implication from a lot of people who are in support of this legislation is that women are not getting care for their miscarriages and their ectopic pregnancies, and therefore this would protect them from that. So there's many things that I would like to clear up about that. Number one is, as a pro-life physician in a red state that currently does not have abortion, we have zero problem treating miscarriages and ectopic pregnancies. We do it regularly. I've treated hundreds of women, and they have not had any problems getting treatment in our local hospitals, in our clinics. I have had no problems calling in medications for these patients. And so the idea that this is suddenly going to be a barrier to them is simply untrue. I think that there is a lot of confusion, but I also think there's a lot of intentional deception taking place with this discussion. And so even in the recent presidential debate, we had one of the candidates saying that women are bleeding in the parking lot because they can't get care due to abortion laws. And the implication was bleeding from a miscarriage. Well, the problem is that's not true. We live in a very pro-life state. We have no problem treating women for these very common conditions. This does not make any kind of miscarriage or ectopic treatment illegal. It has never been illegal in any state. It is currently not illegal in any state in the United States to treat a woman with either surgery or medications for a miscarriage or an ectopic pregnancy. And so the idea that women will die from their ruptured ectopic pregnancy because no one in the hospital will treat them is just not true. With Amendment 3, if a woman has a miscarriage or an ectopic pregnancy, she will actually be less protected with this law in place. And the reason for that is if, let's say, she went to the hospital with an ectopic pregnancy and the doctors did not do the proper treatment or the care was delayed and she ruptured the tube and she bled into her abdomen and she ended up dying. Because that was involving reproductive organs, that patient's family could not sue that doctor. And so in the case of being protecting the patient and actually providing medical care, this legislation would actually be removing protection of the patient, would actually be protecting the negligence or the malpractice that was taking place for the patient because it involved reproductive care. So there would actually be less care for women with this amendment passing. There would actually be less protection. There would be less healthcare supervision for women with Amendment 3 passing. Women and children are not protected by Amendment 3. Think twice before you support this amendment.